The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
So I'm Petar Bajic from the Cleveland Clinic. I'm the Director of Men's Health. And just as a disclosure, I am presenting as a paid speaker by Marius Pharmaceuticals for this talk. I'm also a consultant not only for Marius, but also for Endo, Coloplast, and Boston Scientific. So I'm not going to belabor this, but important safety information regarding KYZATREX, which is a drug that we're going to be talking about today. You can review at your own leisure. Next slide. All right, so we probably have a pretty diverse group watching this. So some of you may feel very comfortable with testosterone replacement therapy, some may not. But for those that might not know, testosterone is a critical metabolic hormone. It plays a significant role in male physiology and health, and a lot of different facets that we're going to get into. There are a lot of different functions for testosterone in the body. It impacts the body in a number of different ways, everything from neurological factors like improving cognition and mood. It's important for energy level. So lack of testosterone can cause fatigue, it can cause depression, it can cause difficulty sleeping. From a cardiovascular perspective, it's essential for regulating blood flow, inflammation, and vascular function throughout the body. And men who have testosterone deficiency or a low testosterone level are going to be more likely to have cardiovascular issues, metabolic syndrome, and also type 2 diabetes. When it comes to muscle, this is probably the area I think that people are most familiar with testosterone's relationship to as we think about people using testosterone to improve lean muscle mass. But testosterone is actually essential in the body for increasing bone density and muscle mass. And it can, if your testosterone levels are low, you can get weaker, basically more brittle bones that can lead to fractures. Things like falls, et cetera, can become very devastating. When it comes to the gastrointestinal tract and the other organs, testosterone is important for motility in the colon, moving food through the digestive system. Men who have testosterone deficiency are more likely to have non-alcoholic fatty liver disease. And then from a urological standpoint, in the urinary tract and the reproductive system, it's essential for normal reproduction. And men who have a testosterone deficiency can experience low libido and erectile dysfunction. Next slide. So this is really what we're talking about today, is a chronic disease, and it's very, very prevalent. It affects millions of men around the world. Next slide. And, when surveyed about their symptoms attributable to testosterone deficiency, men report a variety of complaints. So this, was a ADAM questionnaire, which is the androgen deficiency in aging males questionnaire. It was posted to a website, and individuals were surveyed and data was collected. In this, we saw that men, a high percentage of men rated their enjoyment of life was poor or terrible. 2/3 of men felt that their strength and endurance was bad. 72% of men rated that their sports ability was poor or terrible. I mean, this just speaks to the prevalence of this condition. And, for many of these men, this can be traced back to their testosterone level not being what it used to be, perhaps, maybe related to some other medical issues or overall health problems. 76% of men rated their energy level as poor. 75% reported their libido as being an issue. Happiness level was poor or terrible in almost half of men. So really, you can see a wide range of symptoms attributable to testosterone, and really emphasizing here that these are prevalent problems. Difficulty staying awake. 59% of men after dinner, 3 to 4 times a week fell asleep before they wanted to. 53% of men felt their work performance was also poor, and 72% of men felt the strength of their erections was either somewhat or extremely weak. what is testosterone deficiency or low T? I mean, this is something that we really need to determine using a blood test. Those of you in this call that are providers and seeing patients are very familiar with this, but in order to really establish the diagnosis, it's not just having the symptoms, but you also need to have a deficient testosterone level that can explain those symptoms. Okay. Some of the tests that are used to determine that, or the most common one is a total testosterone that measures basically the overall testosterone levels in the blood. There's a more specific test called free testosterone, which is really measuring just the testosterone in the body that's available for use, that's not tied up doing other things or bound to other compounds in the body. And then sex hormone binding globulin is also important because a higher sex hormone binding globulin, or SHBG, can negatively impact how much testosterone is available to the body. So those of us that do a lot of testosterone replacement therapy, in our practice, are very familiar with using these tests to help guide decision making as far as treatments. Now, there are some kind of like optimal ranges for total testosterone. Above 300 up to 1,000 is considered optimal. This is a wide range, and there's a lot of variability, by patient age. So, younger men tend to have higher testosterone levels. So the question always becomes, is somebody who has a testosterone of 300 normal, but somebody that has a testosterone of 299 low? I don't think that it's necessarily that these ranges should be followed absolutely, but this really does provide some guidance on, where the guys who are in the lowest, maybe let's say 25% of the population fall. And then we have similar ranges for free testosterone and then SHBG, the ranges are there. So just to reemphasize, SHBG binds to testosterone and decreases free T. So you may have a normal total testosterone level, but if you have a high SHBG, your free testosterone, that most important kind of percentage of it, is going to be lower. So it's really important to kind of get that overall picture, and that's stuff that I routinely check. And there are other tests that we commonly use in testosterone patients, one of which is PSA, or prostate-specific antigen, which is a screening test for prostate cancer. It's something that's really important that we monitor while people are on testosterone replacement therapy, because testosterone levels can impact that PSA blood test. That does not mean it causes cancer. It's just something we need to keep a close eye on. Estradiol is essentially estrogens in the body. Testosterone is converted to estrogen in both men and women. So that's something that we do monitor, particularly in individuals that have, certain symptoms we can get into later. Luteinizing hormone is also something that can tell us what the cause of the testosterone deficiency is. If the luteinizing hormone is high, that suggests that the testicles are the problem, that they're not producing enough testosterone. Whereas if the luteinizing hormone is low in somebody that has a testosterone deficiency, that may point more towards the issue being higher up in the brain in the pituitary axis. Follicle stimulating hormone is primarily important for fertility. Prolactin levels also can have an impact on testosterone. And then blood counts, particularly the hemoglobin, a count of red blood cells, is an important monitoring factor that we like to follow in men who are on testosterone replacement therapy. So now I want to get into some of the common misconceptions, and honestly, I hear these all the time in my day-to-day practice, and I think these are some important things that we should clear up, particularly for those who are relatively new to the idea of testosterone and are, maybe have some misconceptions. So the first one is that testosterone replacement therapy is just for bodybuilders. So, this is a common misconception. Really, I think when it comes to bodybuilders and using androgens or testosterone or a variety of other compounds, I mean, these are usually guys that are not deficient in testosterone, so they're not treating a medical problem. They're using testosterone and other substances to try to amplify their athletic performance. And that's really not what we're talking about in this talk. Really what we're talking about is testosterone deficiency, which is a medical problem that's quite common, that can be associated with the symptoms that we talked about. And testosterone replacement therapy is essentially a treatment where we're replacing the hormone that the body is not producing. So this is really, I just want to kind of reframe the mindset around this, that this is an actual medical condition. It's very common more common than we realize, and that we can actually help these men's symptoms if they have a deficient testosterone level by making that level more into the normal range. We would expect to see that their symptoms improve. So we're not talking about something necessarily, to get you into what I call the superhuman range. That's an area where we don't really understand what's, whether it's safe or not. So we try to avoid getting guys into that range and instead try to have the target be the upper range of what we consider that normal range. The second misconception is that testosterone makes men aggressive. Really, this should never happen if you're appropriately dosing the testosterone. It's really when guys get into that way too high range, higher than a human's supposed to be, that they can start getting some of these types of symptoms. And as we'll talk about, there's some differences in the different types of testosterone. KYZATREX, which is an oral testosterone, is particularly good because it doesn't really lead to the levels being so high that they get into the danger zone. And I think when people get their testosterone levels into that way too high zone that you might see with some of the other types of treatment options, that's when they start having some of these side effects like aggression. And if anything, testosterone replacement therapy into that normal or higher part of normal range helps to regulate mood, reducing irritability, reducing depression, etc. Okay. The next one relates to natural supplements. This is probably, I would say, the number one biggest money waster that I see guys doing in my day-to-day practice. Guys go to online or they go to the supplement store and they find these kind of testosterone boosting supplements. A lot of guys don't even really know, like, what is the definition of a supplement versus a pharmaceutical, right? So we kind of throw these words around, but what does it really mean? Really what it comes down to is the level of regulation of a pharmaceutical drug, which is something that essentially, has to either be prescribed or there are over the counters, but they have to go through a certain level of approval. And that approval is really just to demonstrate that they're safe and that they work or that they're effective for what they're being used for. Okay, whereas a supplement does not have to go through any sort of quality control or regulation whatsoever. You could literally put anything you want in a capsule, put it on a shelf as a supplement, and it does not have to go through any testing for safety, efficacy, or even, quite frankly, to actually prove what's in it. So every couple of years, you see these news articles about some supplement getting pulled off the shelf because they found out there was some sort of substance that wasn't supposed to be in it, like a pharmaceutical drug or something like that. So I generally, for the most part, encourage my patients to exercise common sense. Okay, if something sounds too good to be true as far as supplements go, it probably is. If you want to take vitamins or basic kind of stuff, amino acids, things that are in foods that we eat every day, but maybe you're not getting enough of it, I think that makes a lot of logical sense. But you're not going to find some supplement that's going to correct an underlying medical problem, just like you're not going to find a supplement that fixes diabetes. You're not going to find a supplement that fixes depression. Whatever it is, testosterone deficiency is no different. So you guys need to be really cautious about the supplements. If they have a true testosterone deficiency, a supplement is never going to get them there, unless it contains some sort of pharmaceutical drug, which quite frankly is illegal for it to do. But it is something, like I said, sometimes we hear on the news every couple of years. The final misconception that I want to cover is that testosterone replacement therapy causes heart problems and causes prostate cancer. That is absolutely wrong. There's an increasing body of really high quality research that shows that not only is testosterone safe for the heart, but it may actually help to prevent against some of the heart conditions that can happen. Meaning that if your testosterone level is deficient, it's actually more dangerous for your heart than if it's normal. Okay, and once again, we're not talking about getting that testosterone up into that superhuman range where it's not supposed to be that. We've never adequately tested to say whether it's safe or not. I cannot speak to that. But getting that into that desirable normal range, perfectly safe for the heart. And when it comes to prostate cancer, same idea. There's actually increasing evidence that having a deficient testosterone level is actually associated with the more dangerous types of prostate cancer. So that suggests that having a testosterone level in the normal range may actually be protective against the nasty, dangerous types of prostate cancer that some men can get. Now, we don't fully understand the relationship between prostate cancer and testosterone, but in general, those of us urologists who see men with testosterone deficiency, we also see men with prostate cancer. For men who have treated prostate cancer, It's something that many of us, feel comfortable actually giving those men prostate cancer, and even some men who have very low risk, non-aggressive forms of prostate cancer with close monitoring, we can actually safely treat them into that normal range, okay? And that may actually, when done carefully and safely and for the appropriate patients, may perhaps even prevent the more aggressive types of prostate cancer from forming. So probably the most important testosterone study that's come out in the past decade, just recently, not that long ago, came out. It was called the Traverse study. This was a study that was conducted at Cleveland Clinic, where I work, that essentially was the largest study ever to look at cardiovascular risk, which was the main thing they were looking at. And they also, with that study, were able to look at prostate cancer risk related to testosterone replacement therapy. The main thing that they were looking at was whether or not testosterone replacement therapy was safe for the heart, and they proved just that it is safe for the heart. Patients during that study who were on testosterone did not experience any more heart issues compared to those patients who were on a placebo or a fake treatment. So the patients didn't know which one they had. It was either the testosterone or a placebo. None of the patients had a higher risk in the testosterone group, meaning if you looked at all the testosterone patients, all the placebo patients, there was no difference in the rate of heart issues. So that was a really critical finding. And this work was, facilitated by the FDA in an effort to better clarify what that risk was. And when it comes to prostate cancer, same kind of thing. When you compared the testosterone patients to the placebo patients, there was no difference in high grade or really any prostate cancer between the two groups. So that was a really important finding that further emphasized the safety of testosterone replacement therapy, specifically when you take a guy who has a deficient level and put him into the range that's considered normal. So what are the different ways that we can get or use testosterone? Testosterone is interesting testosterone replacement therapy for testosterone deficiency is interesting compared to the treatment of many other medical conditions. Really, if you look at most other medical conditions, the first line therapy has historically always been oral medications, and then you might consider other things like injections if that doesn't work. But interestingly, for testosterone, for many years, for the past several decades, oral therapy was not really an option realistically for our patients. They had to rely on things like injections into the muscles. They had to rely on gels that have to be applied to the arm, or pellets that had to be implanted under the skin. And it's really only in the last few years that we now have oral agents like KYZATREX available. So, it really, I think, makes a lot of sense for patients, particularly who are familiar with taking oral medications for other stuff. And as we'll talk about, it really has a lot of distinct advantages compared to other therapies. So, obviously pills can be administered orally. They don't have to be injected. They don't have to be applied to the skin. They're easy to swallow. All of these treatments are invisible, although there are some options that are actually a patch that can be visible on the skin. The gels can be pretty messy. So a lot of guys really don't like that because when you're applying this gel, it kind of is all over your hands, all over your skin, can get all over your clothes. You have to wait till it dries. There's a risk that it can transfer to other people. So that's kind of a negative about the gels that we don't see with the orals. And then certainly with any sort of injection or even the pellets, which have to be applied using a pretty invasive device, there can be pain. And with the oral medication, there is no pain, obviously. There's also several dosing options for the oral, so you can kind of tailor the dose based to the individual's needs. Certainly you can do that with the other treatments as well, but I think the oral is really the most versatile treatment option that we have. And as we'll probably get into here in a little bit, it actually probably replicates the body's natural testosterone production a little bit more than some of these other options, because the natural testosterone production in the body is kind of highest in the morning, and then by the evening it's pretty much tapered off and mostly out of your system. The oral testosterone really nicely replicates that. So as far as your body is concerned, it's probably the most natural type of testosterone replacement therapy. Whereas injections, for example, if an injection is given once every 2 weeks, you have a couple days where your levels are really, really sky high, probably much higher than they need to be and should be. And then the last couple of days, before the next injection, it's really, really low. So it doesn't really replicate that natural variation within a single day. So, we're going to continue talking about KYZATREX here, which, like I said, a newer oral therapy for testosterone deficiency. And, many, many years ago, like decades ago, oral testosterone got a bad rap because the first generation testosterone agents did have some toxicity to the liver, but KYZATREX is a drug that is a completely different mechanism and is not associated with any sort of liver toxicity. So we're going to talk a little bit more about testosterone or about KYZATREX, but KYZATREX is a drug that's meant to treat adult men who have low or no testosterone levels due to certain medical conditions. That's really important. It is a controlled substance. And it's really only been studied in adults. So that's just important to emphasize. All right, so KYZATREX, the oral agent we're talking about here, is up to 96% effective. This is based on a 6-month clinical trial where they looked at 139 men with low testosterone. 88% of those patients had a normal testosterone level at day 90, okay? And based on the patients who completed the study, 96% of them achieved normal testosterone levels at day 90. These patients also experienced a 30% decrease in mean SHBG levels. So as you remember, high SHBG is bad because that means less testosterone available to the body. And with KYZATREX, we actually see a decrease in SHBG. So more than a double increase in mean free testosterone levels in that study. Advantages we've started kind of touching on, but just to get a little more granular as far as details, it's a twice a day oral capsule taken with food, and it doesn't have to be a lot of food. It doesn't have to be any particular kind of food, but even just a little bit of food. Some people take it with just a little bit of olive oil or peanut butter or whatever, but it helps with absorption because it is absorbed through the lymphatic system. So it does need to be taken with some food. Because it's an oral medication, you don't have to worry about pain associated with injections, or if you're using gels, that it runs a risk of transferring to partners and children and things like that. There's none of that with the orals. And interestingly, it's not affected by, changes in diet. There's really nothing particular you have to do as far as like eating habits with this. And it's not affected by alcohol intake, which is another thing that people are concerned about. I mentioned the prior generations of testosterone, specifically methyl testosterone, was toxic to the liver. That is not something you need to worry about with KYZATREX. It's a completely different mechanism. It bypasses the liver, and it's definitely not the same thing that I learned about in med school when it was oral testosterone, the original kind. There's a lot of different doses available, so you can really adjust that dose and tailor it based on your individual needs, or if you're a provider, the individual patient's needs. Looking at outcomes, this was based on a study that looked at 214 patients and what sorts of improvements or symptom changes they experienced. So when you look at psychosexual function, they reported improved desire, improved mood, more sexual activity, better erections, better erection duration. Another survey they completed called the SF-36 demonstrated they had better energy, less fatigue, better general health as they perceived it, better social functioning. And then when it comes to erectile function, using the IIEF questionnaire, they were able to demonstrate that there was an improvement in erectile function, intercourse satisfaction, and orgasmic function in individuals who took KYZATREX. So what are the most common side effects? This is certainly a big point of conversation when we're talking to men about their options for testosterone. Really, the main only one that I talk to my patients about is high blood pressure. And what we're talking about here is a really, really small increase in blood pressure, even when we see it. It only happens in about 2.6% of patients. And when we see it, it's usually just a couple points. So although it is something that happens, I would argue that it is not a clinically significant change, and that it's not something that we would really need to start somebody on a new medication or make any real adjustments for. Now, one of the most common side effects of other types of testosterone is thickening of the blood, or a rise in that hemoglobin, that blood counter, that hematocrit, which is the other number we use to look at that. That's the reason why some guys you may have heard donate blood while they're on testosterone replacement therapy. In the clinical trial for KYZATREX, no patients had to stop taking the drug because of that issue. Okay, so we don't see as much thickening of the blood. So real quick before we get into the testimonials, why don't we see that thickening of the blood? So essentially, oral testosterone is a short-acting form of testosterone. When you take that morning dose, it's going to reach its peak level within a couple hours. And pretty much if you only took that one dose, by the time you're going to bed, the levels are down again. You kind of stack that with the second dose later in the day, and it gives you really nice levels during the whole day. But then at night, when you don't need that testosterone, your levels are going to come back down just like they would naturally with your body's natural rise and fall in a 24-hour period of the testosterone level. Because of that rise and fall, when we get that kind of break from the testosterone levels not being as high and being a little lower at night, that balance prevents a lot of the side effects that we see with testosterone replacement therapy, like thickening of the blood, rise in the PSA, which is that prostate blood test. Less likely that we see that with oral medications like KYZATREX. Less likely that we see things like the testicles decreasing in size, the estrogen level going up. All that stuff is less common because what we're doing is we're replicating more naturally the body's natural testosterone production. So just a couple of testimonials from real KYZATREX patients. The first one is from David. When I first discovered I had low T, I went with pellet therapy. While pellets seemed fine at first, they eventually became too much of a hassle. The painful implant process, scar tissue buildup, activity restrictions just weren't for me, especially when the effects started wearing off before the next dose. As soon as I heard there was an oral option, that's when I switched to KYZATREX. I love the convenience of the capsules. My testosterone levels are in the normal range. It's made a real difference in how I feel. Another testimonial from Brian. For years, I used testosterone injections, but wanted to switch to an oral TRT. My doctor recommended KYZATREX due to its tolerability and side effect profile, and I've now been on it for 8 months. My testosterone levels are around 700 nanograms per deciliter, and I feel just as good, if not better, on KYZATREX than I did on injections.
If you'd like to learn more about low testosterone or KYZATREX, you do have a few options. So there will be more low testosterone resources in the Resource Center on menmd.com. You can visit this page to view instructional videos, guides, expert articles, and more. If you'd like to learn more or get started with KYZATREX, you can do so by visiting the product page on menmd.com, where you can get started with a valid prescription today. If you still have any product-related questions, we recommend you visit KYZATREX.com just to get answers on common questions, side effects, dosage info. This is all on the KYZATREX FAQ section.
If you found this video helpful and want to stay in the loop with our growing men's health community, be sure to subscribe to our channel and click the bell to be notified when new content is available. Your support makes it easier for other men like you to find these helpful resources. Thanks again for watching. We hope to see you again.